This medication works just like the glucagon produced naturally by your body. It helps increase your blood sugar levels by releasing stored sugar from your liver. It is used to treat severe low blood sugar that may require assistance from others. It's important to make sure that a family member or caregiver knows where you keep this medication and how to use it, so they can help you in an emergency. In addition to treating low blood sugar, Glucagon HCl 1 mg solution for injection and analogs can also be used before certain X-ray procedures of the digestive system. It can help slow down the movement of the stomach, intestines, and colon, which can make the X-ray images clearer. The recommended dose of Glucagon HCl 1 mg solution for injection and analogs is usually one injection given by a healthcare professional. The best time to take this medication is when you are experiencing severe low blood sugar and are unable to take sugar by mouth. Be sure to discuss with your healthcare provider the best way to use this medication for your specific needs. Make sure to read the patient information leaflet and instructions for use provided by your pharmacist. Keep this medication handy in case it is needed, and if you have any questions, ask your doctor or pharmacist. Caregivers should be aware of the symptoms of low blood sugar and be instructed on how to give glucagon if needed. If very low blood sugar occurs, it should be treated right away to prevent serious effects. Before using, check the product visually for particles or discoloration. If either is present, do not use the liquid. It should be injected into a muscle or under the skin as directed by the doctor, and the dosage is based on your age. If the person is unconscious, turn them on their side to prevent choking in case they vomit. If the person does not wake up after 15 minutes, another dose may be given if available. When the person wakes up and is able to swallow, give them a quick sugar source. Glucagon only works for a short time, so keep the blood sugar level up by eating snacks such as crackers, cheese, a meat sandwich, or milk. It's important to call your doctor right away when an episode of very low blood sugar occurs, as you may need more medical treatment or your insulin dose and diet may need to be adjusted. Some common side effects of Glucagon HCl 1 mg solution for injection and analogs include nausea, vomiting, headache, irritation, redness, or swelling at the injection site. However, many people using this medication do not experience serious side effects. If you do experience a fast or pounding heartbeat, it's important to contact your doctor immediately. While it's rare, a serious allergic reaction to this drug can occur. Look out for symptoms such as rash, itching or swelling of the face, tongue or throat, severe dizziness, or trouble breathing. If you notice any other effects not listed here, make sure to speak with your doctor or pharmacist. If you're in the US, you can report any side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. Before starting glucagon treatment, it's important to let your doctor know if you have any allergies, especially to latex. This medication may also interact with certain medical conditions such as pancreatic tumors, adrenal gland problems, or poor eating habits. Low blood sugar is more likely if you don't consume enough calories or engage in heavy exercise. Symptoms of low blood sugar include sweating, shaking, fast heartbeat, hunger, blurred vision, dizziness, or tingling hands/feet. It's recommended to carry glucose tablets or gel to treat low blood sugar. If you don't have these, you can raise your blood sugar by eating a quick source of sugar like table sugar, honey, or candy, or drinking fruit juice or non-diet soda. Make sure to inform your doctor about any reactions you experience. If you are pregnant or nursing, it's important to consult your doctor before using this medication. And always remember to eat meals on a regular schedule to prevent low blood sugar, and check with your doctor or pharmacist if you miss a meal. When taking Glucagon HCl 1 mg solution for injection and analogs, it's important to be aware of potential drug interactions that could impact how the medication works or increase the risk of serious side effects. It's important to keep a list of all the medications and herbal products you are using and share this with your doctor and pharmacist. It's crucial to not make any changes to your medication dosage without the approval of your doctor. Be sure to consult with your healthcare provider before starting, stopping, or changing the dosage of any medicines. This will help ensure the safe and effective use of Glucagon HCl 1 mg solution for injection and analogs. If someone has overdosed and has serious symptoms such as passing out or trouble breathing, it's important to seek immediate medical help. In the US, you can call your local poison control center at 1-800-222-1222. In Canada, residents can call a provincial poison control center. It's important not to share this medication with others. If you have diabetes, it's recommended to attend a diabetes education program to learn more about how to manage your diabetes with medications, diet, exercise, and regular medical exams. Make sure to learn the symptoms of high and low blood sugar and how to treat low blood sugar. It's also important to check your blood sugar regularly as directed by your healthcare provider. Glucagon Hcl 1 mg solution for injection and analogs is used to treat severe hypoglycemia, low blood sugar, in people with diabetes who are unable to take sugar by mouth. It is also used before a medical procedure or test to increase blood sugar. Glucagon Hcl 1 mg solution for injection and analogs works by causing the liver to release sugar into the blood. This medication is given by injection into a muscle or under the skin as directed by your doctor. The dosage is based on your medical condition and response to treatment. The best time to take Glucagon Hcl 1 mg solution for injection and analogs is when you experience symptoms of severe hypoglycemia, such as seizures or loss of consciousness. It is important to always have this medication readily available and to know how to use it in case of an emergency. When it comes to storing Glucagon Hcl 1 mg solution for injection and analogs, it's important to note that different brands may have different storage needs. Make sure to check the product package for specific instructions on how to store your particular brand, or simply ask your pharmacist for guidance. Remember to keep all medications out of reach of children and pets. And when it comes to getting rid of expired or unused medication, it's important to do so properly. Do not flush them down the toilet or pour them into a drain unless specifically instructed to do so. Instead, consult your pharmacist or local waste disposal company for the best way to discard this product. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.